Technique and Surgical Complications by Dr. Luca Antonelli from Ravenna, Italy.
Dear colleagues, good afternoon. It's really a pleasure for me to talk about this novel surgical lateral approach, avoiding psoas divarication and prone position. My disclosure. The purpose of this study is to present the TALPA, Transpsoas Atraumatic Lateral Prone Approach, a new minimally invasive technique that, through a lateral access and appropriate instrumentation, allows insertion of large interbody cages into the spine with the patient in prone position, avoiding psoas divarication and use of any type of retractor inside the psoas. We retrospectively reviewed medical records of 109 patients underwent the TALPA with a series of preoperative diagnoses. An apposite medical report for lumbar plexopathies and nerve injury evaluation was employed. Patients were divided into different subsets in according to the level treated and the level in which the cage was implanted. Surgical technique. TALPA is an acronym for Transpsoas Atraumatic Lateral Prone Approach. The first feature of this technique is that a set of totally atraumatic cannulated instruments with rounded, smooth tips were used. One incision technique with patient in prone position and hanging abdomen was performed. A tubular, atraumatic and radiotransparent retractor was advanced into the retroperitoneum until the muscular fascia of the psoas muscle was seen. After that, a special device called the safe zone viewfinder was positioned near the lateral entrance, and with the help of imaging, the safe zone was centered. This is the safe zone viewfinder. A set of totally atraumatic cannulated instrument with rounded, smooth tips was then introduced into the psoas with the neuromonitoring to center the safe zone of the disc. A guide wire was then introduced into the disc. With the help of X-ray, check the right position of a K-wire. Then, a series of special atraumatic instruments were used to remove the nucleus pulposus and the cartilaginous layer of the vertebral end plates. To prepare the home for the interbody cage, specific trials of increasing size and with the same shape and dimension of the implanting cage were used. For the sagittal imbalance, appropriate trials with 5 and 8 degrees of lordosis were used. After establishing the length and dimension of the cage, a cannulated porous titanium cage with bicortical rest is finally positioned into the disc using the trajectory of the trial instruments and thus avoiding incorrect positioning. All these steps are under X-ray check. Results: the 109 patients underwent TALPA were followed for a mean of 18 months. We observed only one bowel perforation as major complication during the initial experience with the TALPA, promptly recognized and treated without any sequel for the patient. We didn't have any motor nerve lesions, nor vascular complications. Among minor complications, we noticed 7 cases of lumbar sensory nerve plexopathies and 2 cases of hip flexor weakness. All these symptoms disappeared after 4 months from the surgery. In conclusion, TALPA is the first lateral retroperitoneal approach with the patient in prone position, avoiding the use of blade retractors inside the psoas. This technique is reliable and reproducible. We observed mainly minor complications without permanent motor nerve lesions, with only a few cases of transient and reversible sensory nerve lesions. Although these preliminary findings are very encouraging, especially for the few complications, further investigation with the randomized perspective and double-blind clinical studies are needed to confirm these initial results. Thank you very much for your attention.
Questions from the audience, please?
Congratulations, sir. I would like to ask you about the monitoring.
Yes.
Electrophysiological one. Do you use the continuous neurophysiological monitoring and use only the intraoperative one stimulation and things so, or repeat this procedure? Could you answer me?
Now, just during introducing...
Yes, I noticed this because it was very visible on the skin, yes. That's why. And use the directly stimulation of the psoas, yes?
Yes.